Stephanie.
I'm Christina.
I'm Shelby.
I'm Maurice.
And I'm Janessa.
And our topic is diabetes.
Hi, Stephanie. How are you?
Hi, I'm doing good.
Good. Are you here for your cleaning today?
Yes.
Okay. Have there been any changes to your medical history?
Actually, yes. I've been peeing a lot. I have dry mouth. I am sweating so much, and I'm not sure why.
Well, that seems a little interesting. Have you ever been tested for diabetes?
Actually, now that you mention it, they did mention that I might have diabetes.
Really? At your last doctor's appointment? So those are actually the 3 major signs that are used to diagnose diabetes, so that's a little alarming that you have all 3 of them. Have you ever checked your blood glucose?
No, because I never went back.
No? Okay, well, we're actually going to go ahead and check that today just to see if you're good enough to do this dental appointment, okay?
Okay.
Okay, future dental hygienist, let's get right into how you assemble your glucometer. Wait. You haven't even told them the importance of taking their patient's blood glucose. You're so right. So first, let's talk about the importance of taking your patient's blood glucose level. So let's say, for instance, your patient arrived at their appointment and they had not eaten. Because the patient did not eat, their blood glucose level will probably be too low. Or, if your patient is not maintaining a healthy diet, their blood glucose level will probably be too high. In addition, this device helps to ensure they are a controlled diabetic. But let me not spoil what's going to happen to Stephanie at her dental appointment. And let's get right back into the glucometer assembly, my future dental hygienist. Your glucometer kit should include several needles, a lancing device to prick your finger, several test strips, and lastly, a glucometer to measure how much sugar is in the blood sample. Don't forget to one-hand scoop. Activate your lancing device, and you're all set. Now, you'll place your test strip inside, and this will turn on your glucometer. And that's as easy as it gets. I hope you're all set to take your patient's blood glucose at their future dental appointment.
Okay, yeah, your number is way too high to even be seen by me today. So I'm gonna need you to go see a doctor and see if you can get diagnosed and then come back with me with the results, okay?
Okay, what was my number?
It was over 400.
Oh,
Yeah.
wow.
The normal range is gonna be actually 70 to 120, so you're way over that. So just to be careful, you're gonna go see a doctor and just come back with the results, okay?
Okay, thank you.
Have a good day.
All right, bye-bye.
You have diabetes.
Hey, so I went to the dentist and they dismissed me because they think I have diabetes.
What makes them think you have diabetes?
Because I've been peeing frequently, I have sweats, and I have dry mouth, and I did go to the doctors, but I never went back.
So what's your diet like?
Well, I love eating all this stuff.
Well, there's nothing wrong with having diabetes. I have type 2 diabetes, and these are the things that I eat.
Wow.
And I also take medication for it, metformin, that my doctor prescribed me.
Okay.
And this is my favorite.
Let's explain! I am a healthy pancreas, and this is how a pancreas processes glucose. A healthy pancreas produces insulin when carbohydrates are consumed and broken down into glucose. Insulin is like a key that helps convert the glucose to a form the body can transport to the cells. Healthy cells are able to use the glucose for energy.
I'm type 1 diabetic, and that means I'm insulin dependent, which means that the pancreas does not produce insulin, and this is what happens when I digest food.
With type 1 diabetes,
carbs are consumed and broken down into glucose. However, the pancreas is not able to produce insulin, causing the individual to have a high blood glucose level.
I'm type 2 diabetic, which means I'm insulin resistant, meaning my pancreas fails to produce enough or use it correctly, and this is what happens when I eat.
With type 2 diabetes, enough insulin is produced. However, the cells are unresponsive due to the defective insulin receptors.
Welcome back. Have there been any changes to your medical history?
Actually, yes. I went back to the doctors and they told me that I have type 2 diabetes.
I told you that's most likely what was going to happen. Did they put you on any new medications?
Actually, yes. They put me on this prescription called metformin.
Okay, do you take that as prescribed?
Yes, I do.
Here are some of the medications prescribed for diabetes. Patients with type 1 diabetes, also known as insulin-dependent diabetes, may take short-acting insulin, rapid-acting insulin, intermediate-acting insulin, or long-acting insulin, and it is delivered via an insulin pump or injections. Patients with type 2 diabetes, also known as insulin-resistant diabetes, may take metformin, thiazolidinediones, sulfonylureas, and glenides.
Okay, so now that you were diagnosed with diabetes, there are a few oral implications that you're going to need to be informed of. So I'm going to bring a coworker in and we're going to go over those with you, okay?
Sounds great.
Hi Stephanie, my name is Shelby. I just wanted to talk to you about some of the oral implications that you might experience now that you've been diagnosed with type 2 diabetes.
Okay.
So some patients may experience a more exacerbated response to periodontal disease and also dental caries, which is cavities, due to the impaired healing time that they experience. You're also at a higher risk for dry mouth, which can lead to an oral fungal infection. One of the red flag symptoms that you should look for is burning mouth syndrome, where it literally feels like your tongue and mouth is burning, and that can be a sign that your blood sugar is starting to become uncontrolled.
Okay. I'll keep an eye on that.
Because of all of these oral implications that's associated with diabetes, it's really important for you to consistently brush and floss daily. Because plaque is the leading factor to periodontal disease, along with all of these other conditions, it's so important to maintain your oral health. Make sure you brush 2 times a day and floss.
Sounds great.